Today, we have two outstanding leaders in AI. One is Dr. Hooman Rashdi, who's the Associate Dean for AI at the University of Pittsburgh, and the other, Dr. Tran, who's the Associate Dean for Biobanking at the University of Pittsburgh. I'm just going to open this up for both of you. Talk about the different aspects of AI and how are you approaching that at the University of Pittsburgh? And let me start with you, Hooman.
Our main goal in AI is, and I know things like ChatGPT has enamored the world, but we've been doing AI for way before ChatGPT. And so our number one goal within the University of Pittsburgh to make sure that people understand that AI is an umbrella term, that it's not all one thing. And also, it's more around education before we actually dive in on operational research, clinical aspects. We typically group them into non-generative AI, things that we've been doing for decades, like cancer prediction versus not. Generative AI, where things that are like chatbots that actually create things, new things, which is under our synthetic data arm. Each one of them has their own advantages and disadvantages. At the end of the day is through education, as we teach the global audience and the users of what's the best practice on both of these domain frameworks, then they become better users so that they not only can maximize the capabilities of these things, but also understand their limitations.
I was brought in to modernize the biobanking infrastructure at University of Pittsburgh. And obviously, a special population like children, right? Samples are hard to come by, but we also live by quality data that needs to feed into this AI infrastructure. So junk in, junk out. You don't have the good data, you're gonna have junk AI. So we're building that infrastructure now, modernizing, bring together all the biobanks, including samples coming from the Children's Hospital, many investigators working there and modernizing that. But at the same time, I also serve a role at our Computational Pathology and AI Center of Excellence as the senior director there. And we're trying to apply a lot of these AI solutions produced by this center, including the classification tools. We've seen in the past where sepsis prediction, if it's generically trained, it's not going to work well in special populations, such as children. So if we're able to actually train it and specialize and better generalize these models, they become better performing in these special populations. And on the generative AI front, we're now working with various tools that are now localizing, so installing these generative AI chatbots on a single computer so you can use it in the field. This could be used for both rural medicine applications, but again, if you're out in the middle of nowhere with no internet connection, but you need advice for medical care, you can now access these chatbots that could give informative information to help manage some sort of medical emergency.
What makes the both of you most excited? What can we anticipate in the next 5 to 10 years? And I know AI is changing so rapidly on a daily and weekly basis, probably hard to project 5 to 10 years.
Currently, most people, when they are addressing AI or wanting to deal with AI, they're typically only doing it with vendor-based framework, things like ChatGPT or Google or Claude and other frameworks like that. We know with time, we need to have a hybrid model, meaning that as a society as a whole, to make sure that we can maximize its impact, we can't basically put in all of our efforts within API or cloud-based frameworks that could make it cost prohibitive with vendors. So having this hybrid framework that I'm excited about that Nam mentioned on, where whenever there is a return on investment for a system where you go with vendor-based frameworks like a Microsoft, like Google and whatnot, and whenever that you can provide similar efforts with local frameworks that could save the system a lot more money, you basically then pair that up with the vendor-based frameworks in terms of being able to provide more to more people. But besides that, you also can improve, accuracy, cybersecurity issues, IP, and other frameworks like that.
I'm most excited about seeing these technologies move towards edge AI, right? So I'm also in the world of point of care testing. So being able to move these technologies, diagnostic capabilities beyond the confines of the ivory tower hospital walls, we're now improving access to care, moving this out, including with AI to help interpret results, help with quality. So we now allow these technologies to be now just not confined to a hospital space, but now to these far reaches of healthcare within our communities and far hard to reach communities. Unserviced, populations are now, having a tough time dealing with chronic conditions, right? So we want to be able to move that towards the field and be able to deal with hospital at home, urgent care at home concepts.
Thank you both again for joining us in Lead in Peds Unplugged. And thank you for all that you do. And I'm looking forward to future collaborations. And for our full version, where we discuss a broad array of science happening at Children's National, please please go to wherever you download your podcasts and download The Lead in Peds. Thank you for joining us today.